Hello again, and welcome to my Lead What You Live podcast with Tina Lizzio. That's me. I am here in the studio today, and I have a very special guest and friend who's coming here to us from New Jersey today, a Dr. Betsy Greenleaf. And this woman is on fire. Wait till you see her and have fun. This is going to be a fun show and conversation with where we go in flow. She is a triple board certified doctor in obstetrics and gynecology, a gyno-urologist, and she's in aesthetics and longevity as well. You can find her at the International Pause Institute as well as the Pelvic Floor Store. So we're going to get into all things Dr. Betsy Greenleaf. Welcome to Lead What You Live.
Oh, thank you so much, Tina. I'm so excited to have this conversation with you.
Thank you. You are one of the most fun people that I ever see on social media. You are just so real and authentic and fun. And so in a world where people are skeptical, cynical, and serious, we need more of your fire energy with your gorgeous red hair. It suits you so perfectly well. And so again, thank you for being here with me today. I had the pleasure of meeting Dr. Greenleaf. We are part of a global woman club entrepreneur mastermind in New York. And I actually got to see her last week, which was great. And I thought this is overdue for us to have a conversation and have you join me because you, in fact, lead women in what you live and have so much knowledge and experience and the wisdom that comes from it to impart to all of us. It's very informative for men as well. So this isn't just for women. This is very informative for you guys out there as well. So Betsy, talk to us. Tell us, how did you even start and desire to go into women's medicine, into becoming an OBGYN? And then how did that segue into your desire and how you saw the value and also be getting into gyno-urology?
You know, it's funny because as a gynecologist, I didn't, I wasn't like a little kid who was like, I want to look at vaginas all day long. Like, at no point in my life was I like, that's what I want to do. And even then, it was a funny story with residency. I remember actually having lunch with a friend of mine who was a resident, and she was a podiatrist, and I was an OBGYN. And I looked at her across the table and I was like, how do you look at people's nasty feet all day long? And I thought she was going to choke on her sandwich. And she's like, do you realize what you're looking at all day long? And I'm like, oh yeah, I kind of forgot. So actually, I was always interested in medicine. And they say you can't connect the dots looking forward. It's like when you look back,
Exactly.
they make sense. Like when I was like 4 years old, my mom was pregnant. I remember she had books laying around that talked about pregnancy, and I was like obsessed with looking at these books, and there were images of the baby inside the mom's belly. And at the same time, there was a TV show called Emergency that was on TV. And probably like as a 4 or 5 year old, I probably shouldn't have been watching that TV show, but it was like it was an ambulance crew in California that it was based on. And so I was obsessed with that. So from a young age, there was definitely an interest in medicine. But even then, when it came to college, I actually wanted to become a veterinarian. And being a New Jersey resident at the time, and still there really isn't, they're just starting to form a veterinary school in New Jersey. There wasn't a school here. And so I applied to medical school as my backup plan because trying to get into veterinary school is a lot harder than it is to get into medical school because there's not as many schools. So I got into medical school and I thought I'd do pediatrics, and because I said, oh, babies and dogs, they're not too far apart. I mean, and I
Less
just had
complicated than adult humans.
yeah, because like babies can't tell you what's going on, dogs can't tell you what's going on. It's kind of the same,
Right.
But then I just found myself in the surgery subspecialties, and I really loved it. So I actually started off in general surgery because I couldn't decide between general surgery and OBGYN, and I got halfway through that. And then, listen, general surgeons are amazing people. You need them when your appendix is burst, but they're like body mechanics, and meaning like they just get in, they get the job done, and and you're on your way. which is great. That's what you want in your general surgeon. But I wanted more of a relationship with my patients. So I was the one as a general surgery resident going around on the floors doing my rounds. And I'm like, so how do you feel now that your gallbladder's out? How do you feel about like losing your appendix? So there really isn't time for that in general surgery. So I found my way to OBGYN because I could have that relationship with the patients long term and do the surgery and do all the other fun stuff. And then, coming back to looking at vaginas all day long, you become very desensitized in medicine when you're exposed to things day in, day out, and to the point where, I mean, you can hear the way I talk. I talk about vaginas and penises and sex like it's no big deal because that's all I talk about all day long. So to me,
That sounds like fun.
Those topics aren't taboo. So I'm
Right.
always shocked when I'm like in public and I'm talking about these things and people get offended. Or if I'm getting kicked off of social media, which is happening all the time. Like yesterday, I just had a post that was taken down off of I had a post taken down off of Instagram because I talked about masturbation and mental health. And I guess apparently you can't be talking about the masturbation part on social media. So I'm going to try to
Wow.
repost that. We'll try to sneak it in there
Sneak it
again.
in. We can talk about that as part of our conversation today if it goes there.
Yeah.
No holds barred here.
Yep.
That's awesome. And so also it's bringing life. I mean, you're bringing miracles into the world.
Yeah.
I have three grown children, and so and there are, like in most most specialties, still fewer women today that are doctors, let alone triple board certified, than men.
Yeah.
And there is a real need for women supporting women. So my C-sections, I had three cesareans actually. The first one was due to failure to dilate and pelvic disproportion, which led to scheduled subsequent C-sections. So I had three kids within 48 months in my 30s, and I had a male doctor. And I was in New Jersey also, actually. I was in New Jersey, and I delivered two of my three there, the other one here in Florida, where I've been living for 20 years. And after I crossed over 40, I had my kids, something hit me like, it's a little weird to go to a male gynecologist who's never had a period, who doesn't really understand a woman's body, and it's a female doctor. So I'm going to switch and I'm going to find myself, a female gynecologist. And so I've been going to a female ever since, for like 15 years now. And, all things, knowing there's going to be the hormonal changes and going through menopause and all that fun stuff. So it's such a gift that you actually chose to become a gynecologist and to serve women because there is a need. Yeah.
I don't mean to interrupt you, but
Yeah.
like I find, and I kind of agree with you in some ways, but I think it's really finding the right doctor versus finding one in a specific sex. Because I've had female doctors way before I was in medicine who dismissed me because I was getting recurrent yeast infections, which, fast forward, it was related now. I know it was related to my diet, but at the time when I was 18, 19, didn't know this, and in general medicine didn't know this. So I had a female doctor who like really blew me off and was like, oh, I get those all the time. It's no big deal. Where then I've had
Interesting.
a male doctor who was like, listen, I've never been through this, so I'm more like going to spend more time listening and trying to understand your point of view. So I think it really comes down to like the individual as opposed to, if they've gone through it. And of course, there's good and bad on both sides. So
That could be said for everything. I
yeah.
mean, I think the C-suite is held there. It's more and more women are holding top positions, but it's still like 80-20.
Yeah. Oh
At the
yeah,
top
definitely.
in those top positions. So it's
Oh, and
growing.
forget venture capitalism. That's a whole
That's
nother
a whole
thing.
other thing. So there are, more industries that are more female dominant, than male, et cetera. I just really appreciated, I guess it was something that because I was getting older and the changes is where I started saying, I feel more comfortable now that we're going to talk about hormones and changes to be speaking
Yes.
to a doctor who herself has gone through it, understands it. So that was sort of my thinking in making the switch.
Yeah.
And I loved the male gynecologist obstetrician that I had who delivered my babies, successfully. So yes, I'm glad you pointed that out. So how did that lead you to want to also get certified as a urologist
Well,
and study
interesting.
urology?
Yeah, so interesting. I actually never delivered babies as my profession. I went straight into urogynecology. So, when I was doing my OBGYN rotations as a resident, I really liked the surgical aspect, but the training is very, very heavy on obstetrics. And in fact, years ago, obstetrics and gynecology were two separate fields. And then they joined, and now they're talking about making it two separate fields again, which I actually think it should. But
Can you
unfortunately,
make
when
the
I went,
distinction for the viewers, the
oh,
distinction
so
between obstetrics and gynecology?
yes, yeah. So obstetrics is a doctor who delivers babies and manages pregnancy, where a gynecologist is somebody that would be managing women's health throughout the whole life cycle. So, but the obstetricians are just focusing on that, like pre-pregnancy, pregnancy, immediate post-pregnancy, trying to get
Just
pregnant.
like a midwife, right? Also in
Yeah,
the
very,
holistic approach, but same thing, the way
very,
a
very,
midwife supports without the medical degree.
yeah, very, very similar. So, I came from doing general surgery and I really liked the surgery. And I didn't know that urogynecology even existed until my very last rotation in residency. So it was a little bit too late to actually get into a training program at that time. So my plan was after residency, I was going to work for a year and then apply for fellowship. And I just got really lucky in that I reached out to the fellowship director to say, hey, at the program I was at, I said, I'm interested in doing this. This is my plan. I'll apply again next year. And he goes, well, actually, we have an opening because the guy who was supposed to get the opening that year didn't pass his boards.
Oh,
And that was one
wow.
of the requirements. So they're like, we actually have an opening. Do you want it? And so I got really lucky and was able to like walk right into it. So then I did my training in urogynecology, which is and some people go, what in the world is urogynecology? I remember telling my mom that I was going to be doing this, and she's like, is it like fancy gynecology, like European, like you heard like Euro Disney? And I'm like, no, like Euro has to deal with urology, which is having to deal with the urinary system. So bladder, well, urology more deals with kidneys, bladder, all the whole urinary system, where urogynecology, we really deal more in the pelvic area. So we deal with all the organs, anything from the bladder, the reproductive organs, the colon, the rectum, anything from like the belly button down and the waist up. So it
So
was
would
a
a
new,
woman go to you who's experiencing hemorrhoids, for example? UTIs, the yeast
you,
infection is basic. All those, the impact on at the same time the ovaries, the cervix. If they're having fibroids, like this is still all your department.
Yeah, it could be. It could be definitely. So, and then there's even more. I mean, the hemorrhoids could be, but the hemorrhoids could also be a colorectal doctor or a proctologist.
Right.
So,
Right.
yeah, which gets more like, can you imagine? Like, people ask me about being a vagina doctor, but can you imagine, like, I'm being a proctologist and be like, you're just a doctor of the anus.
Right.
Like, like that is
You're
like
like,
that's
it's
even more specialized.
vaginas is one thing, looking at assholes all day.
Which I think a lot of us do in our work, but that's a whole different
That's a whole
story.
other conversation. So is there something that you are, what are you mostly, what are some of the top two or three issues in urogynecology that women are facing that you're dealing with today?
Yeah. So probably recurrent urinary tract infections is probably the biggest one.
Yep.
Then incontinence, so leaking when you cough, laugh, sneeze, or not being able to hold it in and having to run to get to the bathroom. And the other thing would be prolapse. That's where things start drooping and dropping. It's like, I always say, it's like my bladder fell and can't get up. It's like, so the walls of the vagina when we're younger are a little bit stronger. There's ligaments there. And then because of life and pregnancy and having babies or coughing or bearing down to have bowel movements, those ligaments can rip and tear and stretch. And now things just like gravity takes over anything on our body.
Yep.
Gravity starts taking over, and the bladder can drop, or the uterus can drop, or the rectum can drop, and then everything kind of just is coming down and potentially even out. So, yeah, and 50% of women will actually experience a prolapse at some point in their life. Doesn't mean you always have to do anything about it, but that's something that a urogynecologist particularly would take care of.
And women, I imagine, who have vaginal births are much more prone to having this happen. Like I had 3 cesareans, so I may have some future pelvic floor issues, even though having not passed a baby through my vagina. So therefore I may not have, or I in the future, the same incontinence issues, that like
Yeah.
you speak of. Women say they sneeze or they're, jumping around and. So what do you say about that? I imagine because of the trauma,
Yes.
short term, of course, and the bodies were designed for that, but having vaginal natural birth would be more inclined to have issues.
Definitely having a vaginal birth does put you at higher risk, but not having a vaginal birth doesn't save you. And I will tell you from personal experience, my colleagues love to laugh at me about this one because I had 2 elective C-sections because I know too much of what can happen to your pelvic floor. And I'm like, I'm not letting a baby come out that way. Like, let's do the C-sections and protect my pelvic floor. And sometimes just the weight of pregnancy can damage the ligaments. So I ended up myself having a prolapse rectocele, which is your rectum dropping repair years ago. So it didn't save me. So
It
it can. And then there's women who've never ever been pregnant, but let's say they have problems with constipation or they have asthma or chronic cough. Like anything that puts pressure on the pelvis can do this. A lot of us don't lift properly. I mean, you see the big weightlifters and they're blowing out as they're lifting. Well, because
Yes.
they're trying not to give themselves a hernia. And a prolapse is just a type of hernia. So when we lift heavy things, we shouldn't be like holding or straining. We should be blowing out to not put that pressure down on the pelvic floor.
Yeah, to be exhaling. So I know that yes, UTIs are an issue, and it's everything from young college age girls that may not realize that, hey, you better shower off after you're having sex, or don't stay in those Lululemon leggings after sweating and hot yoga for too long, or change the bathing suit after you get out of the swimming pool. These are things that I understand can lead to UTIs.
Yeah.
And then separately from that, you have, maybe it's because of the incontinence, but it becomes common in older women, like post-menopause. Older women will experience it a lot.
Yeah.
Because of that regular like leakage. So whether you're, 22 or 82, it's like for women, it's an issue. And so what is a holistic approach to treating that? Like you hear out there, take cranberries or cranberry supplements or D-mannose, or what do you suggest to women, both preventive and cure of UTI?
Well, you mentioned my favorite is cranberry and D-mannose. So the idea is, well, why do the urinary tract infections happen? Is because, and I'm going to take it back even further in a minute, but we'll get to the basics. Is that bacteria just gets into the bladder and it attaches to the bladder wall. Most commonly, it's a bacteria called E. coli that has these little, like they're called flagella. They got these little kind of like feelers that go and they like to adhere to the bladder wall. So the idea is what cranberry does is it kind of makes the bladder a not fun place for the E. coli and the bacteria to want to attach to, so it prevents its attachment to the wall. Where the D-mannose is a type of sugar, and what happens is these organisms like to live and eat off of sugar. So the D-mannose is not a sugar that we absorb, but it attracts the bacteria. So the bacteria wants to go to that and attaches it to that instead of our bladder walls, and so we end up just peeing it out. So
Ah,
that's how both of
it's like
those
a
work, which is
binder, if you will.
yeah. So those are pretty fun. But then we have to question back, well, why does urinary tract infections happen? And from a traditional medical standpoint, it's like women have very short urethras, which are the tubes we pee through that lead up to the the bladder. And so any friction in that area can push bacteria up in that area. So that we see that often after women have had any kind of sexual activity, that they're more prone. This is why we tell people pee after sex or any kind of sexual activity so that you're flushing out any bacteria that may have got in there. But from a holistic, integrative functional medicine standpoint, we actually take it even a step further in that the vagina really is the reservoir for the bad bacteria, and the rectum. And the rectum and the vagina and
They're
the
very
urethra
close to each
are
other, and you
so
got to be
close to.
careful during sexual activity.
Yeah, and you know what? I mean, like, listen, I don't like having panty lines in my pants, when I'm wearing cute pants, but those thong underwear, like when you're walking, they're going, like floss, and
Yeah,
they're
you're
just,
rubbing
they're
from your ass
spreading the
to your, yeah. That's
back
a
and
good, wow, I didn't even
forth.
think about that.
Yeah, and then as I've gotten really into the microbiome, which is the bacteria that lives in our body, there's bacteria in each area. Our mouth is different than our vagina, and it's different than our gut and our colon, and it's different than our skin. So there's healthy bacteria that's supposed to be places. But if our gut bacteria is off, which it can be from diet or um, poor diet or stress, that can now bring that bad bacteria closer to the vagina. And then in the vagina becomes a reservoir. And now that can get into the bladder. So it really starts as far back as what we're putting in our mouth and what we're eating and what we're putting in our brain, like what kind of stress levels we're exposing ourselves to, because all those things can throw off the gut, which can then throw off the vagina and then the bladder.
So much is being has been researched and is being talked about now about the importance of the balance and the microbiome. So think about intimate partnerships. And so, even if you haven't even gotten to sexual intercourse or anything, just the swapping of saliva and, with somebody, and their you're exchanging DNA,
Yeah.
within that, in the microbiome. And then that goes a step further. And you talk about like oral sex. So somebody's got the issue in the microbiome in the mouth, and then they're like, going down on a woman with her vagina. I mean, what is going on here? It's like, if you think about it, there's so much potential, right? There's potential for different types of infections. So
Yeah. Oh,
hygiene is
definitely.
like of utmost importance for
I
people.
actually saw a podcast and I'm still thinking about this one. It was two guys talking though. And it was very interesting. On the podcast, one of the men brought up how performing oral sex on a woman may be beneficial for a man's health. And it
If
kind of
she's
caught my
healthy,
attention.
yeah.
And I went, hmm. And then the more I thought about it and the way this guy explained it, I'm like, you know what? I might not be able to argue this one with him. It's not that great for a woman, but for a man, I'm like, all right, this act or the performing partner, male or female, because if a woman's microbiome is healthy, she has a lot of lactobacillus bacteria in the vagina. And that's the one that keeps the vagina healthy. And that's also one that is often found in yogurt. So, yeah, I guess in theory, that performing oral sex on a woman with a healthy vagina might actually help your gut
We're on
microbiome.
to something here.
I was like, and I still was like, you know what? I really can't argue this one. But
And,
then my argument is, what is that oral microbiome of the giving partner
well, that's
that
what I'm saying.
that needs to be
If they're very
healthy?
healthy, they could be passing it on through the woman. The skin is very thin there, right? And
Yeah.
the
Yeah.
absorption. So I presume that it could work both ways. You
Yeah.
talk.
I don't have any scientific evidence on this, but it's
No,
just
there
in
is
theory.
research. I'm telling you, I've read and heard other people talking about it. That's why I brought that up. I mean, again, the microbiome super, super important. And so you talk about the pelvic floor. What are the main things that when we hear about Kegel exercises? What
Mm.
are the main things that women can do to support the pelvic floor? And I know that there are these, there's like eggs out there, or you can put in there and do exercises, the yoni egg. Can you please tell us about the pelvic floor, like how to support the pelvic floor, what women can do?
Sure. Well, the biggest thing is that the pelvic floor is open to gravity. So it's really only lined by muscles, fascia, and skin. So there's really not much holding it in there. And unfortunately, we start losing about 8% of our muscle mass every decade after the age of 30. So one of the problems is we think about exercising our arms and our legs, but we don't think about exercising our pelvic floor. So you hit on it. Kegels are probably the greatest way that we could be doing it. But I find that most people, I would even say up to 80% of people do their Kegels wrong. First of all, I don't know why a lot of women will be like, I do it every time I pee. And I'm like, yeah, no, that's not what we should be doing. So the Kegel exercise is tightening your pelvic floor. Why in the past they told you to do it when you're urinating is just long enough to figure out what those muscles are. So they're the muscles that would stop your urine flow. They're the muscles that would hold in a fart when you don't want to fart in public. Like those are the muscles that you want to use.
So it's that
But
perineum. It's like from the vagina through the perineum to the rectum. That whole area
Yeah,
is what we're
surrounds the
defining
everything.
as the pelvic floor.
Yeah, it surrounds the whole area. So really, when you're doing it when you're urinating, the problem is the bladder is also a muscle and it's going to contract. And if you're trying to hold it in while your bladder's trying to push out, the urine's going to go where the least amount of pressure is, and that can be back up to the kidneys. So don't do the Kegels while you're peeing. You can do it just to figure out where the muscles are, but then after that, don't do it. You think of, and I stole this from my friend, I can't take credit for this one, is that think that you have a giant straw coming out of your vagina and you're trying to suck up a thick milkshake. It's that more lifting and sucking kind of sensation that you're doing with the Kegels. So it's more like a lifting and tightening. So that is something that you can do. And how people can do it is you can just hold it for a count of 10 and try to get up to where you're doing it 10 times. Like any exercise, you want to start slow because you can tire out these muscles. You can also do what's called quick flicks, where you tighten really fast for 10 times and, tighten, relax, and do that 10 times. So
It's like breathing exercises for the pelvic floor.
yeah. And so a lot of people accidentally push down instead of sucking up. So it should be like like picture a sucking up and tightening position. And you can do it that's the thing, you can do it anywhere. Like
Perfect. I'm just doing it right now while I'm sitting here.
Right now. So the other thing is anything that brings the legs together. So that so bringing the legs together, this may be sitting down with a ball between your legs, with a towel between your legs, or at the gym, the machines that bring your legs together. So anything that kind of like pulls the legs together will also activate that pelvic floor. Now, the Kegels are great as long as you're not triggering muscle spasms. If you have pelvic pain or you're getting muscle spasms, you want to do the opposite. You want to think about relaxing those muscles. But in general, we need to build those muscles just as if we'd be doing exercises for our arms and our legs. In addition to that, it's also incorporating protein in our diet because we start losing protein as we get older, and we need protein to build muscle. So you need to be, eating at least, medically, they say 1 gram of protein per kilogram of
Body weight.
Body weight. But
per kilogram or pound?
Well, in the medical community, it's kilogram, but in the weight loss community, we say per pound of body weight. So, yeah. So kilogram is like 2.2 pounds. But yeah, if you're trying to lose weight, it's 1 gram of protein per
So
pound
it's even more. Yeah.
Yeah.
You're like
And then,
eating almost double the protein for weight loss.
yeah. And so then, and you're talking about the yoni eggs and all these little devices. So
How about using vibrators?
Yes, you can, because
For anything
that
that you can use to practice, like using the muscle. And
to tighten
so
around. Yeah.
there's that masturbation conversation I had to weave in.
And there's all different, there's companies like there's companies like Plus One that makes a really inexpensive one that looks like a little yoni egg, but it's made of silicone and it has a little handheld device. And if you're doing it right, the lights light up. There are a couple other companies that make them that work with an app. So they actually gamified it. So you put something in the vagina and then you watch on the app and you can like play a game to like do your pelvic contractions.
Now, are these things that you have? You talked about the pelvic floor store.
Yes.
So you have some of these products on your, I know that, right? On your site available.
And it's funny because of the fact that this was a suggestion of a patient because I would recommend these products and then the patients would be like, well, where do I find it? And I'm like, okay, go to this website and that website and this one. And finally, one day, one of my patients said, why can't this all be in one place? And that was back in 2018. And I was like, well, I don't know how to make a website, but I can go YouTube how to do it. So like I literally made a website and put all the products that I recommend on one
Oh, that's
place. And I'm
awesome.
always looking for
You
new things.
did.
So
That's awesome, and we spoke about that. And so, of course, let's talk about sex, baby. So, you're passionate now. You, like I, have crossed over the 50 and fabulous mark, and we've raised children and gone through hormonal changes, and so we're there to support other women going through that. What is your stand on hormones, balancing hormones, bioidentical hormones? Should women do? What is your suggestion as they go into perimenopause? They start becoming irregular with their periods, etc.
I love hormones. So, but I didn't always because the traditional medical community scares you about that because of the Women's Health Initiative study that came back out in I think it was in 2000. Um, right when I was finishing my residency, it scared all the doctors from using hormones. And there's still this prevalent idea that hormones cause cancer and hormones cause heart disease. But we now know that it was the hormones that were used in that study that were the problem, not hormones as a general topic. So the hormones in that study were not
Synthetic.
bioidentical, were not natural. And so now know that the unnatural hormones are incredibly inflammatory. They are processed in the body in a completely different way that actually can damage your DNA and can potentially lead to cancer. I can't say that taking them, you're going to get cancer. It says all of these are potentially, they increase risks of these things. So I still think it's criminal that these hormones are still on the market, but I don't think they'll ever come off the market. But um, now, natural hormones, or you may hear them as bioidentical or bioequivalent, they are what's naturally in the body. And so they act in a different way. So they're not going to be inflammatory if they're in balance. And that's the thing, anything in balance, because too much of a good thing is not a good thing. If you ate too much broccoli, that would be a problem. So if you get too many of your like natural hormones, that's still going to be a problem. So it's all has to be in balance. And so the problem is we're never going to see the research on these hormones because you can't patent what naturally occurs. And so if you can't patent anything, then you can't start a business and protect your intellectual property, and there's no money in it, and there's no money in research.
It's
So we're
very
never,
customized also,
yes.
It's like one size doesn't really fit all. But I think it is important for women to understand in balancing the estrogens and the progesterone and the testosterone. Often I'll see
Yes.
women are increasing testosterone without estrogen and progesterone, or they're taking progesterone at night to help for sleep, but they're not looking at the estrogen and the testosterone. So what do you say about that, really the importance of sort of balancing all three in a natural, way?
Yeah, I really think it's a combination of looking at all of the hormones, but more so looking at stress because sex and stress can't coexist. And when I say that, the process by which our body kind of uses these hormones is that when you're in a nice, relaxed state, your body will naturally make sex hormones. But if you're under any stress, whether that's mental stress, not eating healthy, not drinking enough fluids, staying up too late on your TikTok or whatever, with the blue light, there's so many stressors in our life that's actually sucking away our sex hormones because our body can only be in one state or the other.
Mm.
It can't be in stress and make sex hormones. It's got to be sex hormones are made and used in a relaxed state. Stress because about, if
Kills
you're being
them.
yeah, if you're being chased by a lion, when we were cave people, I mean, these systems are really smart. If you're being chased by a lion, it's not the time to be eating and digesting your food. It's not being the time to reproduce and have sex with your honey. It's the time for all your energy to go into your muscles, away from your gut, away from your pelvic organs, away from making hormones, and all into being able to fight that lion, run away from that lion, or stay incredibly still. That lion can't see you. So I always tell people that if you're having problems with your hormones or your sex life or fertility or digestion, any of those things, because that relaxed state is rest, digest, sex. So if any of those problems, you need to go look at the stress levels because that's what's sucking
And
things
the
away.
cortisone levels, speaking of hormones, looking at the
Yeah.
cortisol levels. Listen, sex is a great stress reliever. But
Yes.
yes,
Yes, it
if you're
is.
under a lot of stress, that it makes it, I hear what you're saying, is that it reduces the sex, hormones and can really like reduce the drive, right? So
Yeah.
drop in hormones, any kind of hormones
Oh,
can sort of
sure.
impacts the libido and the sex drive, et cetera. Yet, so what does regular, sex, flowing, the orgasm, the oxytocin that gets produced from the intimacy, how that helps and supports hormones?
Oh my goodness, there's so many health benefits and this is where if you don't use it, you lose it. I mean, having a active sex life, even if that means with yourself, because if you don't have a partner, think of this as your pelvic physical therapy, because there's so many benefits from maintaining pelvic health to mental health. Because, specifically, I'm going to quote a study that was done by the Plus One company, was that they found that people using even sex toys, which we don't call them sex toys anymore, they are intimate devices because really they need to be looked at from a health standpoint, is that using and just stimulating down below. There is a 90, and it doesn't even have to lead to orgasm, just stimulation. There's a 90% increased risk of, or risk, 90 increase in mood. We get
You
94%.
elevate your mood big time.
Yeah, 94% increase in sleep. So we know it helps mood, it helps sleep, it helps confidence. If you're feeling sexy, you're gonna walk into that board meeting and you're gonna maybe like feel more confident to ask for that raise. So, and we know that oxytocin can make you feel closer if there's a partner. And then this is something I do get in trouble with on social media all the time when I talk about using these devices, is people are like, oh, I don't need a device. I have a man. Well, we don't always need to think of them as solo use, though solo use is a good thing because once again, remember doing something, multiple times a week, daily. It's going to be like exercising your pelvis. So there are health benefits, but these are things you can also, these devices, these intimate devices, you can incorporate with partners.
I was going to say, it doesn't have to be, I only use the devices if I'm single and don't have an intimate partner.
Yeah,
You can bring that in, but
it's not an or, it's an and.
it's an and, yeah. And so I think that it's also like many other things because we're releasing that oxytocin, that pleasure hormone,
Yeah.
that, it's like the more that you are in flow and you have that experience, the more you are driven to have that. And so, being a woman, it's like I can always tell when any of my friends or peers like, I see. So she's in flow, like, someone's getting a lot of sex here, or those who are not and need to get laid. So you can sort of sense that energy, right? You can sense everything is energy. And so we feel people's energy. And I'm not saying that you can't be high energy if you're not having sex, but it absolutely is like fundamental to us as human beings and moving our energy. Could you speak into that more? Because I know your focus really is supporting, as you would say, tell me, women over 40.
Oh, yes, I help them feel great, look great, and fuck great.
Yes, ma'am. Exactly. Feel great, look great, and fuck great. And
Yeah.
so, because as those hormones drop too, over time, there's that thinning of the lining. And some
Yes.
women will experience like pain because, and that's from a loss of, is it the estrogen? A loss of
Yeah.
estrogen. And so it's, there are different type of, again, the organic and holistic things that you can use to, make the tissue healthier and things like that to support that. But I know that that's a big thing, women are experiencing. So if it hurts to have sex due to a drop in hormones and you deal with clients like this, then it's like you want to fix that because they want to have sex, but it hurts and that's impacting intimacy and the relationship, etc. Many
Yeah.
couples, they go into their, 20, 25 years of marriage, forget the fact that it's like, the same old thing, but sex starts dropping off because of the drop in hormones and the drive and these issues that happen to the
Yeah.
body.
So there's a bunch of things. I'll let me talk about the couples real quick, and then I'll get to the dry vaginas. But you know what's interesting is that the longer you're in a relationship, the more difficult it is to have sex because of a process called habituation. It's that anything in the body that's at a steady state that you're exposed to constantly, the body starts to tune out. So this is why when you're first with, a partner, it's so exciting because you're getting these dopamine hits and all this rush of hormones. But over time, it's not that it can't happen, it's just it gets harder and harder to get that same like high from the partner. So that we know that the human brain really responds to novelty. And that doesn't mean that you need to go get a new partner, but it may be trying to introduce some novelty into the relationship, whether it's intimate devices, going on
Putting
vacation.
on wigs.
Yeah, putting on outfit, whatever works for you. You got to, that's something you guys have to work out. But yeah, you got to try to change it up and make things
Yes.
new. Then when it comes to the dry vagina, unfortunately, we start going through losing our estrogen because our ovaries go into retirement, and that's our main source of estrogen. We can still make some estrogen postmenopausal from conversion of testosterone from our adrenal glands, which are glands that sit on top of your kidneys, but it's just not enough to kind of keep things going. So when you get that drop in estrogen, the vaginal tissue thins out and it becomes more easy to rip, tear, crack. And some women will complain that it feels like cut glass or that they're being torn open.
Sandpaper.
And yeah, or sand, it's terrible. There are so many amazing options to fix this that you just don't have to give up. Because I see women are like, well, I had a good run, like that part of my life is over. And it doesn't have to be. We can be sexual beings all the way into our 90s and beyond, our whole lives. So, there used to be that there was only estrogen creams and tablets and rings that we could insert into the vagina, but now there's a whole spectrum of treatments. Beginning in 2016, the first laser came to the United States, and I will tell you, I get my vagina lasered every year. It's part of my maintenance, and so the laser uses light energy to basically biohack your vagina. And
Is
that
it like
within
a wand that you're sticking in there like a dildo?
yeah, yeah,
When you
that
say
that
laser, it's something that's going inside.
Yeah, so you have to go to a practitioner to have it done, but it uses, I mean, they've been using lasers for people's faces since the 1980s, and it was not me, I wish it was me, was very smart and came up with a wand that goes in and it uses the light energy, basically causes a microscopic injury, and the body floods that area to heal it with growth factors and basically triggers the vaginal tissue to regrow and that
Amazing.
collagen without having to use hormones. And so that opened the floodgate on using aesthetic procedures in the vagina. So now there's also radio frequency using sound waves to rejuvenate the vagina. There is shock wave therapy for the vagina, and that uses also a different type of sound wave to trick the tissue into rejuvenating. You can actually use PRP, which is platelet-rich plasma, where a practitioner draws some blood out of your body. They spin the blood, they get your growth factors and the plasma, and then they go and inject that back into the tissue. And then during the pandemic, nobody could go get their vaginal rejuvenation because nobody, well, at least here in New York, New Jersey area, nobody went anywhere for about 2 years. And so that's when we saw the evolution of home-based therapy devices with a product called Joy Lux, which is a red light wand, because we know that
Is that
exposing your
something the individual can buy?
Yeah, you can buy and
Joy
do it.
Lux, Lux or Luxe?
Yeah. Joy Lux is the company, the V Fit is the product.
Okay.
And it is a red light wand that, so red light, it basically, it looks like you put it in your vagina, it looks like your vagina is glowing. Like, like ET phone home. It's like, like now that I'm dating myself, we like, hopefully people have seen ET,
Right.
his your vagina will be glowing red. But you put this device in for about 12 minutes. You do it a couple times a week, and exposing your tissue to red light actually stimulates the mitochondria, which are the growth anti-aging powerhouses of your cells. So, I mean, I would love to get a red light bed, but those are very expensive. But like exposing my whole
Right.
body. I do have a red light face mask that I do
Well,
wear
your
from time to
skin
time.
looks absolutely
Yeah, yeah.
gorgeous. I so appreciate your openness, your candidness, your just, boldness to be like a pioneer in that sort of combo that urology, gynecology, the aesthetics, all things to support vaginal health, and that for it's everything. It's like I said, it doesn't matter. This is for young women to in their teens and 20s all the way. And yes, I will be one of those having sex into my 90s. Thank you very much.
Yes.
I know you will. You will too. I'm going to need a part 2 with Dr. Betsy Greenleaf because that's just the beginning. So thank you so much, Betsy, for taking the time, because you're off to a super fun weekend this weekend with the family. And thank you for taking the time out. And we can reach you again at
So there's Pause Institute, like pause, like taking a pause, institute.com. There's also pelvicfloorstore.com, and I'll give you guys 10% off with the code TINA10. So,
Tina
and
10 for 10% off on the goodies at the Pelvic Floor
yeah,
Store. I'm going to go make some
social
purchases today
media,
myself.
social media. And lastly, if you're on Spotify or Apple Music, I do have a menopause rock album called The Menopause Memo that you can find at Dr.
The
Betsy Greenleaf.
Menopause Memo on Spotify and Apple Podcasts. Awesome. Dr. Betsy Greenleaf, thank you. Thank you so much. And this is not goodbye. This is to be continued.
Thank you.